The city hums a smoky tune, a saxophone sighs to the moon.
Hello, welcome again. Today we are going to be talking about basic life support. You heard me right, BLS. Okay, so you are out there, you're not sure what CPR means. I will do a separate video about CPR. I've done a live before about CPR, but today we're talking about basic life support. Listen to this video to the end because it's going to help you, and it's a very short video, straight to the point. So now, basic life support is the initial care given to a person with cardiac arrest, respiratory arrest, or airways obstruction until advanced care arrives. So this is literally something that you can actually do in the house. If you're with a loved one outside in the pool, in the river, on the roadside, and somebody collapsed, suffering from either of these three things I've told you, you can literally do this. The aim of BLS, or basic life support, simply is to maintain circulation and oxygenation to preserve brain function. Because without the brain functioning right, that person is gone. Now, what are the chain of survival here when you're talking about BLS, basic life support? One is the early recognition of emergency or call for help if required. Number two, early CPR, or high quality chest compression. When I mean high quality chest compression, you're doing your 30 chest compression and your 2 rescue breaths. Number three, early defibrillation, as in AED, automated AED. You really need that. And number four, advanced life support. Okay, then number five, that's the main one, cardiac arrest care, the post care. All right, now steps in adult basic life support involve so many things, but the basic things you need to know about basic life support is the checks. One is the responsiveness. Tap the shoulder of the patient or the person that's collapsed. Shout, "Are you okay? Leah, are you okay?" Then number two, if there is no response, what you need to do, call for help immediately. Activate emergency response system. If you're your own, please get somebody to get the AED for you in the nearest AED station. It depends on what the part of the world you're from, but the AED are located in various places. Number three, check breathing and pulse at least 10 seconds. Then look for normal breathing of this particular patient or person, and also check carotid pulse. If no pulse or unsure, start CPR straight away. Carotid pulse is a pulse that is here, and that's the last pulse in human body. I've done a video about that. Then number C is the circulation. You look for the chest compression. Very, very important. Now, what are you looking for here? The features, the guidelines, hand position, center of the chest must be at the center of the chest. Center of the chest, then lower half of the sternum, please. And the rate of your compression must be, please 100 to 120 compression per minute. And the depth of the chest compression must be 5 to 6 centimeter deep, please. Then allow full chest to recoil. Interruptions, please try to minimize it as best as you can. Then when you're doing this, you are at the same time, you keep checking, go back to what we call the ABCD. The A stands for obstruction, airways, sorry. Airways, open airways. Usually you tilt the head backward and you move the chin, leave the chin as well. Automatically, it will open the airways. If trauma is suspected, then you have to do jaw thrust. Then B stands for the breathing. So give a rescue breath after 30 compression to your patient or to the person you're looking after. Each breath over 1 second. Visible chest rise. The diaphragms of the chest must rise and close and go back. Then C, compression, ventilation ratio. So for adults, single or 2 rescue breath. That is, you do 30 compression and 2 rescue breath. Very, very important. Make sure you get somebody. If you're the one doing the compression and you're calling for help at the same time on your mobile phone that is on loudspeaker, get somebody to get the AED. That's the automated external defibrillator. That is very, very important. So if you're out there, look for where that is being located. Use as soon as it's available. Then turn up. Follow the voice prompts and instruction. Then ensure no one touches the patient during shock. When shock is to be administered, it will tell you leave patient, go at a distance, obey. Resume CPR immediately. Shock has been delivered. This is a very straightforward BLS lecture you can ever get, and it's very straightforward. When to stop CPR, return to spontaneous circulation as soon as you can. Advanced teams take over. Say, for example, the paramedics has arrived. That is the only time that is one of the times, not the only time, one of the times you can stop CPR.